Good morning. Welcome to Dementia Q&A. I'm Dr. Marc, internist and geriatrician. Today's question, what is dementia? I am asked that question all the time. Dementia is not just one disease. It's really a collection of diseases that all have four common characteristics. First, they are not acute. They don't happen in the blink of an eye, right in front of your very eyes. Dementias come on slowly. They're chronic and progressive. And that can be very frustrating for patients and for families because they often have to look back months or even years to detect those first symptoms and when they started. Second, all the dementias involve memory. They involve other cognitive processes in the brain, things like language, orientation, planning, but they all involve memory. Typically, short-term memory is affected first. Third, those cognitive problems that they're having and the problems with memory eventually lead to more and more difficulty for people to do their activities of daily living, whether that's out in the community or at home, without making a ton of mistakes and without needing any additional help. For most of us, we take for granted our ability to head out in the community, drive, navigate, take public transportation, go to the store, shop for what we need, come home, we cook, we clean, we pay the bills, we take our medications, and then we take care of ourselves in the bathroom, we shower and groom, we use the toilet, and we get dressed. We do all of those things without making a lot of mistakes and without really needing any help. In the dementias, the cognitive problems eventually cause us to have difficulty with those tasks. More mistakes are made, and eventually over time, more and more assistance is required. Fourth, unlike some diseases in the brain, where the problem is that the cells of the brain can't communicate with each other well, they can't signal back and forth correctly or appropriately, and sometimes there's medications for that. Good examples might be schizophrenia or depression. In the dementias, the problem is that cells of the brain, typically neurons, are dying or have already died. In fact, if you look at MRI or CAT scans of people with dementia much later in the disease, you will see that the brain appears to have shrunk because so many cells have died. Two things you need to know about dementia right off the bat. First, it is not a normal consequence of aging, meaning dementia is not inevitable. That's good news because a lot of us plan to live to a ripe old age. Second, just because you are occasionally forgetful does not automatically mean you have dementia. Dementia requires a combination of cognitive difficulty and memory trouble, along with an inability to do things for oneself without making mistakes and without needing help. Only together can you have a diagnosis of dementia. You don't have dementia just because you can't find the keys once in a while. I hope that this definition of dementia is useful for you as you work through a diagnosis with a loved one or are thinking about yourself. If you have questions about dementia you'd like a geriatrician to try to answer, please put them in the comments section. And if you've liked or shared or subscribed to this page, it is greatly appreciated. Thank you so much for listening, and I'll see you all next week.